All right, here's my quick phlebotomy site video. So we use veins from our patients, which carry deoxygenated blood back to the heart and lungs to draw our blood from. So veins are our phlebotomy sites. The first one on your objective sheet to cover is the marginal ear vein. Just like your pulse points and your lymph nodes, there is a left and a right to these as well. Veda's right marginal ear vein can be found around the perimeter of her ear pinna. And I think that your picture, the dog there labeled Q, does a good job illustrating the marginal ear vein. We usually use this on rabbits or pigs, and sometimes our floppy-eared dogs like bloodhounds or bassets. But typically don't use them too often in our companion animals, maybe just to get a little prick of blood to do a blood glucose curve, but not as commonly used as the next ones that I'll talk about. Speaking to that, the next one we come to is the jugular vein. There is a left and a right jugular vein. Just on the lateral aspect of the thoracic inlet are the jugular furrows or jugular grooves in our patients. And this is where the left and the right jugular veins live. This is a great place if we're trying to get a decent amount of blood, so we can get larger quantities from our patient when we draw from the jugular. Veda, can you show them your jugular groove? So we have the thoracic inlet. I can go on either side, on the lateral to that, down into her jugular furrow or jugular grooves, and her two jugular veins would be found there. You will learn in 160, VM 160, how to restrain and hold off to palpate, but that is where her jugular veins would live. Moving down to her front limbs, the next common phlebotomy site is an animal's cephalic. Veda, can you sit? So let me see if I can get this into the picture so that you can see. Perfect. So the cephalic vein, again, left and right, runs on the cranial aspect of the limb, on the cranial aspect of the radius and the ulna, just down the midline of those bones. So let me see, stay. This is much harder than I would think it would be. Veda, can you sit? So if I were to pull up her limb here, hold off by rolling medial-laterally, her cephalic vessel or vein would run right down the middle there of her forelimb over her radius and ulna. And again, this is her right cephalic vein used for blood. Okay? And then last but not least, we have the saphenous veins. Can you sit up? Good girl. So in a canine species, the lateral saphenous is always used to draw blood. Let me see if I can try to get this on camera. It actually travels a bit caudal to cranial, if that makes any sense. As I restrain and hold off just proximal to her stifle, I'll be able to see her lateral saphenous, and it will traverse again, like I said, sort of caudal to cranial, just proximal to that tarsus area. So you can't see, of course, because she has very long hair and she's very fluffy, but her lateral saphenous, there's a bit of a groove here that you can feel in your patients, just proximal to that calcaneus. So her lateral saphenous is right here, and it's traveling sort of like this. And that's what we use on our canine species. Our feline species, we use the medial saphenous, which if I put her on her side, would be on the inside of her down leg, and that traverses down the medial aspect of the femur and the tibia and fibula down the leg, and that again is the medial saphenous. That is your common phlebotomy sites.